so much, and good morning, Nigerians. And I want to say Happy New Year to everyone.
Same to you, ma'am.
And our prayers to Almighty Allah, it will be a better year and a year of consolidation, a year that we will begin to see the outcomes, the results of the promises made during the campaign by His Excellency President Bola Ahmed Tinubu. I was opportune to work with him pre-election to refine the promises. And I have seen the passion in him and the commitment in him to the health sector development in Nigeria. So I led the Presidential Advisory Committee on Health, where we drafted the policy document that His Excellency endorsed around 8 priority areas. But with the main focus, the main vision of President Bola Ahmed Tinubu is to see that we deliver quality healthcare services to all Nigerians, irrespective of where they are, irrespective of gender, irrespective of social determinants of the people. And this is what he has remained committed to it till today, after 1.5 years, around the 8 priority areas. And as you have said, I'm very glad that the 2 professors at the sub-national levels have alluded to a lot of progress that have been made in the last 1.5 years. So if you take each of the 8 component areas, the first is about the leadership and governance, and we have seen the team that have been assembled by His Excellency under the leadership of the Honorable Minister of Health, the Coordinating Minister of Health. For the first time in Nigeria, we have Minister of Health called Coordinating Minister, and it's deliberate and intentional by His Excellency to ensure that health sector does not stand as a standalone, but it is all encompassing because it has several other factors that drives health that are outside the health sector. So the Minister of Health coordinates the overall sector, not only at the national, but also sub-national level, connecting with other sectors of development, like water resources, security, and all that, agriculture, education, women affairs, and several others. So I think this has clearly been demonstrated that we are working towards that, and it's a good success story. So in terms of looking at some of the commitments, I think they have all said a lot in terms of that. One key area out of the 8 pillars were around local manufacture. And the first thing when the minister came was to recommend to His Excellency to approve presidential, a national coordinator and a structure that looks at the value chain, unlocking the healthcare value chain in Nigeria. And a lot of tremendous progress have been made towards that. We've seen all the engagement, we've seen the attraction back to the country of potential investors in Nigeria, manufacturers of drugs and medical equipment. And we've reached several other advances. And we are going to see a lot of changes in 2025 in terms of realization and implementation of those commitments. Then another area that you have seen, which is key related to how do we achieve universal healthcare coverage, is the strengthening, which Prof has already mentioned, of the primary healthcare. Because the primary healthcare facilities forms the platform for delivery of healthcare for Nigeria, especially when you talk about vulnerable Nigerians, which constitute a significant proportions of Nigerians, over 70%. So there has been an expansion of the primary healthcare to 2 PHC per site per ward, 2 functional primary healthcare per ward in all our constituents in Nigeria, and also expansion of the universal healthcare insurance coverage. This has all increased to ensure that we have increased access to healthcare services. And we've also seen the budget, which they've also mentioned about, because without funding, it is not possible. And this is in addition to several other funding mechanisms that have been established in the last 1.5 years, not only in government, but also at the sub-national level, development partners, and harnessing all those resources to maximize effect, what was His Excellency positioned himself to do, and the Minister of Health is matching that, where he is now coordinating the overall national health sector investment, under one platform, and using the mechanisms of what we call the sector approach, the swap processes, and this is led by himself, the Minister of Health. So it is aimed to bring all resources together, so that we harmonize and maximize the effect of our resources. So we have one national plan, one implementation plan, one delivery plan, and then the conversation is the same. And this addresses our priorities in the country. So it's not like where we have fragmentation in the past, and then whoever comes with resources just go in and do whatever they want to do. So all these have been addressed in the country, and I think these are very remarkable efforts that have been put together.
Absolutely. The impact of governance and leadership in the healthcare sector is quite visible. I wanted you to give us figures, if any, in 2024, because you talked about 2 primary healthcare centers in each ward. In 2024, what is the value addition in terms of functional and well-equipped primary healthcare centers?
So in 2024, over 16,000 primary healthcare facilities are functional. And when we talk about functionality, delivering quality healthcare services, over 40,000 healthcare providers, frontline workers only, have been trained, in addition to several other frontline health workers that have been trained to improve their quality, of service delivery.
Are these new intakes?
These are new plus those that are already existing, because that have not had training in several years and are not delivering quality services. So we expect to see improvement in our quality of services, because a lot of surveys have shown in the past that Nigerians have recorded very poor quality service delivery, especially at the primary healthcare level. So that was why we focus on capacity development, capacity building of the frontline health workers, because these are healthcare providers at the first point of contact within the primary healthcare. So these are numbers that we can see clearly in terms of improvement, and then the uptake of services. And of course, it's too early to talk about the statistics, but the National Health Demographic Health Survey, which was released, the result, which took place in the last 5.5 years, covered the last 5.5 years, has indicated some modest improvement, especially in the area of maternal and child health improvement.
But it's still high. It's still high. It's almost, it's per 100,000. We're hitting up to 1,000.
Well, it's still high. The NDHS of the last one, 2018, it was about 512 per 100,000 live births. So work is still in progress to come out with the latest statistics, but it's too early to get the results. But I strongly believe in the next few years, we don't have to wait for another 5 years. In the next 2 years, we should be able to see remarkable improvement because of all the interventions and then the new strategic and innovations that have been deployed and adopted. So, but if you look at other areas like contraceptive, uptake of family planning, which is also a huge game changer towards improvement of maternal health, there has also been some slight improvement in that area, especially in states that have recorded less than 1% in the past. Today we are seeing remarkable improvement of about 5%, 8% improvement in family planning. So we are not saying that it's a success story yet. There are lots of work to be done, but the progress that has been made in terms of laying a solid foundation, towards delivery of quality healthcare has taken place in the last 1.5 years. So what we expect to see in 2025 is to see implementation, realization of the aspirations of President Bola Ahmed Tinubu, because has created a lot of opportunities and then created a lot of enabling environment. Because if you also take the area of local manufacture, one of the areas that the president did was to areas that are bottlenecks, to realization of the potentials of improvement of local production of medicines, pharmaceuticals, and diagnostics, and some equipment, is the importation tariff. And he has passed an executive order that banned, eliminated that bottleneck of value-added tax and also additional tax for importation.
All right, many thanks, Dr. Anas, but I'd like to stay with you because of the point that you made that this administration is committed to delivering quality healthcare to all Nigerians. And we know that if you want all Nigerians to access quality healthcare, you must talk about the costs. And when you talk about costs, we want to talk about the Health Insurance Act. Speak to us about how the National Health Insurance Authority Act, impacted on access and affordability of healthcare to Nigerians in 2024.
So this is a very critical area also of commitment of President Bola Ahmed Tinubu, because one area he said he's going to reach about 50 million Nigerians that will have access to affordable, almost free quality healthcare services to Nigeria. And the first thing he did was the expansion of the mandatory health insurance scheme, so that people that attain primary healthcare have free access to services, secondary as well as tertiary institutions. But this is within the formal sector, but also outside the formal sector. People are also free to have access to it. So it's still work in progress because of the economic situation. A lot of changes have happened. So the purchasing, what they have proposed before, may not be able to do, but work is ongoing to also improve on that. So with the current allocation and then the current approval of the vulnerable group fund, there is a vulnerable group fund that was also approved by the president, all aim to ensure safety net, and the financial protection for Nigerians, especially vulnerable people, so that they can be able to afford healthcare services and also able to access healthcare services within their reach.
Okay. Maybe we should get to Maiduguri now.